3 hidden dangers in your mouth. After 60, last week a patient walked into my office. Lovely woman, 72 years old, takes care of herself, walks every morning, eats well. She sat down in my chair and said something I'll never forget. She said, "Dr. Miles, I brush twice a day, I floss, I do everything right. So why do my teeth feel like they're falling apart?" And when I looked in her mouth, I saw exactly what I see in so many of my patients over 60. 3 silent problems that nobody talks about, but that are stealing your smile, your confidence, and yes, even years from your life. I'm Dr. Ethan Miles, and I've spent over 25 years as both a health specialist and a dentist, working specifically with adults like you who are navigating the changes that come with aging. And here's what most people don't realize. The mouth you have at 65 is not the same mouth you had at 35. Your body has changed. Your medications have changed. Even your saliva has changed. And if you don't understand these 3 hidden dangers, you could be losing teeth, dealing with constant pain, or worse, putting your heart and brain at serious risk without even knowing it. Now, I know that sounds scary, and believe me, I'm not here to frighten you. I'm here because I care deeply about this. Because every single day, I see people who could have avoided painful procedures, expensive treatments, and genuine health crises if they had just known what to look for. So today, I'm going to walk you through these 3 hidden dangers. I'm going to explain why they happen, how to spot them early, and most importantly, what you can do right now to protect yourself. And listen, I want you to stay with me through this entire conversation because the 3rd danger I'm going to share is something that even most dentists don't explain properly to their patients. It's connected to your overall health in ways that might genuinely surprise you. So let's dive in. The first hidden danger is something I call the silent thief, and it's called dry mouth. Now, I know what you're thinking. Dry mouth. That doesn't sound dangerous. That sounds like an inconvenience. But here's what most people don't understand. Saliva is not just water. Saliva is your mouth's natural defense system. It washes away food particles. It neutralizes acids. It delivers minerals that keep your teeth strong. And it contains proteins and enzymes that fight off bacteria and prevent infections. When you're young, your salivary glands produce about 1.5 liters of saliva every single day. But as you age, especially after 60, that production starts to slow down. And it's not just aging, it's the medications. Blood pressure pills, antidepressants, antihistamines, pain medications. If you're taking any of these, and chances are you're taking at least one, they're reducing your saliva flow even more. I had a patient, wonderful man named Robert, 78 years old. He came to me complaining that his dentures weren't fitting right anymore. He kept adjusting them using more adhesive. Nothing worked. And when I examined him, his mouth was so dry that the tissue under his dentures had actually started to break down. He had painful sores. He couldn't eat properly. And he was miserable. But here's the thing. Robert didn't even realize he had dry mouth. He thought it was just normal aging. So let me ask you something. And I want you to really think about this. When was the last time you woke up in the middle of the night needing water? Do you find yourself sipping drinks constantly during meals just to swallow your food? Does your tongue ever feel sticky or rough? These are signs. Your body is trying to tell you something. And here's why this matters so much. Without enough saliva, your teeth become vulnerable. Cavities that would normally take years to develop can form in just months. I'm talking about root cavities, which happen right at the gum line where your tooth root is exposed. These are painful, they're hard to treat, and they can lead to tooth loss faster than you'd expect. But it gets worse. Dry mouth also leads to gum disease, bad breath, difficulty speaking, and even trouble tasting your food. Imagine not being able to enjoy a meal with your family because your mouth is too dry to taste anything properly. So what do you do about it? First, talk to your doctor about your medications. Sometimes there are alternatives that don't cause as much dryness. Second, drink water throughout the day, not just when you're thirsty. Keep a water bottle with you. Sip regularly. Third, avoid things that make dryness worse, like alcohol, caffeine, and especially tobacco. And fourth, consider using products specifically designed for dry mouth. There are special toothpastes, mouth rinses, even artificial saliva products that can help. But here's my biggest piece of advice, and please hear me on this. Don't ignore it. Don't assume it's just part of getting older. Because the sooner you address dry mouth, the easier it is to manage, and the more teeth you'll keep. Now, the second hidden danger is something that genuinely shocks people when I explain it. It's called root exposure and root decay. And if you're over 60, there's a very good chance you have it right now and don't even know it. Here's what happens. Throughout your life, your gums naturally start to recede. It's a slow process, maybe a fraction of a millimeter each year. You don't notice it happening. But by the time you reach 60, 65, 70, those gums have pulled back enough that the roots of your teeth are now exposed. And here's the critical thing to understand. The root of your tooth is not covered by enamel. Enamel is that hard, protective outer layer on the crown of your tooth, the part you can see when you smile. But the root is covered by something much softer called cementum, and cementum cannot defend itself against decay the way enamel can. Think of it like this. If the crown of your tooth is like a castle with thick stone walls, the root is like a wooden shed. It's vulnerable. And once bacteria get to that root surface, decay can spread incredibly fast. I've seen patients lose perfectly healthy-looking teeth because decay started at the root and worked its way deep into the tooth before anyone noticed. I remember a woman named Margaret. She was 67, very health-conscious, came in for her regular cleaning. And during the exam, I noticed some sensitivity around one of her lower molars. She mentioned that cold water bothered her sometimes, but she figured it was just sensitive teeth. When I took an X-ray, what I saw broke my heart. There was significant decay at the root level. The tooth looked fine on the outside, but underneath, it was compromised. We caught it early enough to save the tooth, but if she had waited even 6 more months, we would have been talking about extraction. Now, here's what makes root decay so dangerous. It often doesn't hurt until it's advanced. You might feel a little sensitivity, maybe some discomfort with sweet foods. But by the time you're feeling real pain, the decay has usually reached the nerve, and now you're looking at a root canal or losing the tooth entirely. So how do you protect yourself? First, you need to keep those exposed roots clean. And I mean really clean. Brushing twice a day is essential, but technique matters. Use a soft bristled brush. Don't scrub hard, gentle circular motions. If you brush too aggressively, you'll actually make the gum recession worse. Second, fluoride becomes your best friend. I recommend using a fluoride toothpaste, and if you're at high risk, ask your dentist about prescription strength fluoride. It can make a massive difference. Third, floss every single day. I know, everyone says that. But with exposed roots, food and plaque get trapped right at the gum line, and that's exactly where decay starts. And here's something most people don't do but should. After you eat, especially if you've had something acidic like orange juice, tomatoes, or soda, rinse your mouth with water. Just swish it around for 30 seconds. It neutralizes the acid and washes away debris. It's such a simple thing, but it can prevent so much damage. But there's something else I want you to understand about root exposure. It's not just about decay. Exposed roots are also why your teeth feel sensitive. Hot coffee, cold ice cream, even cold air can send a jolt through your tooth. And that sensitivity is your tooth telling you that it's vulnerable. Don't ignore it. There are desensitizing toothpastes that can help. There are treatments your dentist can apply. But the key is addressing it before decay sets in. Now, I want to pause here for just a moment because I know we're covering a lot. But stay with me, because what I'm about to share next is the hidden danger that connects your mouth to your entire body. It's the one that can affect your heart, your brain, your blood sugar, and even your risk of stroke. And most people have no idea. The third hidden danger is chronic gum disease, and specifically, how it silently spreads inflammation throughout your entire body. Now, you might be thinking, wait, gum disease? I've heard of that. That's just bleeding gums, right? And yes, that's part of it. But what most people don't realize is that gum disease is not just a dental problem. It's a whole body problem. Let me explain how this works, because once you understand this, everything changes. Your gums are living tissue. They're full of blood vessels. When you have gum disease, you have a bacterial infection in your mouth. Those bacteria don't just stay in your gums. They enter your bloodstream every single time you chew, every time you brush, every time you floss. And once they're in your bloodstream, they travel throughout your body, triggering inflammation. Now, inflammation is your body's defense mechanism. It's supposed to help you heal, but when you have chronic, ongoing inflammation from untreated gum disease, your body stays in a constant state of alert. And research is now showing us that this chronic inflammation is linked to heart disease, stroke, diabetes, Alzheimer's disease, and even certain cancers. I had a patient, wonderful gentleman named Thomas, 74 years old. He had a history of heart problems, had already had one heart attack. His cardiologist was managing his medications, his diet, everything, but Thomas kept having issues. His blood pressure wouldn't stabilize. He was tired all the time. And then, during a routine dental exam, I found severe gum disease. His gums were inflamed, bleeding, and infected. I immediately contacted his cardiologist, and together we came up with a treatment plan. We treated the gum disease aggressively, deep cleanings, antibiotics, better home care, and within 3 months, Thomas's cardiologist called me. He couldn't believe it. Thomas's inflammation markers had dropped significantly. His blood pressure was more stable. He had more energy. Now, I'm not saying that gum disease was the only factor, but it was a major one. And the scary part, Thomas had no idea. He didn't have tooth pain. His gums bled a little when he brushed, but he thought that was normal. He had no idea that his mouth was creating a health crisis in the rest of his body. So let me ask you this. When you brush your teeth, do your gums bleed? Even a little bit? Because healthy gums do not bleed. If you see blood when you brush or floss, that's a sign of inflammation. That's your body telling you something is wrong. Do your gums look red or swollen? Do you have persistent bad breath that doesn't go away even after brushing? Have you noticed any teeth feeling loose or shifting position? These are all warning signs of gum disease. And here's the thing about gum disease. In its early stage, called gingivitis, it's reversible. With good oral hygiene and professional cleanings, you can heal your gums completely. But if it progresses to periodontitis, which is advanced gum disease, you start losing the bone that supports your teeth. And once that bone is gone, it doesn't grow back. You can manage the disease, you can stop it from getting worse, but the damage is permanent. Now, I know some of you are thinking, okay, Dr. Miles, this is all very serious, but what do I actually do? How do I know if I'm at risk? So let me give you some practical steps. First, if you're over 60, you need to see your dentist every 6 months at minimum, not just for a cleaning, but for a comprehensive exam that includes checking your gum health, looking for signs of decay, and screening for oral cancer. Yes, oral cancer, that's another risk that increases with age, especially if you've ever used tobacco or drink alcohol regularly. Second, you need to be honest with your dentist about your overall health. What medications are you taking? Do you have diabetes, high blood pressure, heart disease, osteoporosis? All of these conditions affect your oral health, and your oral health affects them right back. It's a two-way street. Your mouth is not separate from your body. It's part of your body. And what happens in your mouth impacts everything else. Third, your daily oral care routine needs to be excellent, and I mean truly excellent. Brush for 2 full minutes twice a day. Use a soft bristled brush and replace it every 3 months or sooner if the bristles get worn. Floss every single day. If traditional floss is hard for you because of arthritis or dexterity issues, use floss picks, interdental brushes, or a water flosser. The goal is to clean between your teeth where your toothbrush can't reach. And use an antimicrobial mouthwash, not just for fresh breath, but to reduce bacteria and inflammation. Fourth, pay attention to your diet. Sugar is still the enemy, even at our age. Every time you eat or drink something sugary, the bacteria in your mouth produce acid that attacks your teeth. And with exposed roots and dry mouth, that acid does even more damage. So, limit sugary snacks and drinks. And if you do have them, rinse with water afterward. But here's something that might surprise you. It's not just sugar. Acidic foods and drinks can also weaken your teeth. Things like citrus fruits, tomatoes, vinegar, wine, and soda. They soften the enamel and the root surface, making them more vulnerable to decay. Now, I'm not saying you should never eat these things. I'm saying be smart about it. Don't sip on acidic drinks throughout the day. have them with a meal, and always rinse with water afterward. Fifth, if you smoke, please consider quitting. I know that's easier said than done, especially if you've been smoking for decades. But smoking is one of the worst things you can do for your oral health. It reduces blood flow to your gums, which means they can't heal properly. It weakens your immune system's ability to fight infection. It increases your risk of gum disease, tooth loss, and oral cancer, and it makes dry mouth even worse. There are resources available to help you quit. Talk to your doctor, join a support group, use nicotine replacement therapy if you need to, but make quitting a priority. Now, I want to talk about something that a lot of my patients deal with, and that's dentures or partial dentures. If you have dentures, you might think, well, I don't have to worry about all this because I don't have natural teeth anymore. But that's not true. Your gums, your jawbone, and your oral tissues still need care. Dentures can cause sore spots, infections, and bone loss if they don't fit properly or if they're not cleaned correctly. You need to clean your dentures every single day, just like you would clean natural teeth. Use a denture brush and a denture cleaner. Don't use regular toothpaste because it's too abrasive and can scratch the denture, creating places for bacteria to grow. And take your dentures out at night. Your gums need time to rest and recover. Sleeping with your dentures in can lead to infections, inflammation, and faster bone loss. And here's something really important. If your dentures don't fit well anymore, don't just use more adhesive. That's not a solution. Ill-fitting dentures can cause serious problems. They can rub and create sores. They can make it hard to eat, which leads to poor nutrition. And they can accelerate bone loss in your jaw, which makes the fit even worse over time. See your dentist. Get them adjusted or relined. Or talk about whether it's time for a new set. I know dentures are expensive, but your health and quality of life are worth the investment. And while we're on the topic of missing teeth, let's talk about dental implants for a moment. I have patients who ask me all the time, am I too old for implants? And the answer is almost always no. Age itself is not a barrier. What matters is your overall health, your bone density, and your ability to heal. I've placed implants in patients in their 70s and 80s with excellent results. Implants can give you back the ability to eat the foods you love, smile with confidence, and maintain your bone structure. If you're missing teeth and struggling with dentures, it's worth having a conversation with your dentist about whether implants might be an option for you. Now let's talk about something that affects many of my older patients, and that's medications. As we age, we tend to take more medications, and many of those medications have side effects that directly impact your oral health. We already talked about dry mouth, but there are other issues too. Some medications can cause gum overgrowth. Others can increase your risk of bleeding. Some can affect your bone density, which impacts your jaw and your teeth. And certain medications can interact with dental treatments. This is why it's absolutely critical that you bring a list of all your medications to every dental appointment. And I mean all of them. Prescription medications, over-the-counter drugs, vitamins, supplements, everything. Your dentist needs to know what you're taking so they can provide safe and effective care. For example, if you're on blood thinners, we need to take special precautions before certain procedures. If you're taking medications for osteoporosis, we need to be aware of potential complications. If you're on steroids or immunosuppressants, your ability to fight infection is compromised. And here's something else. If you're scheduled for a major medical procedure like heart surgery or joint replacement, talk to your dentist beforehand. You want to make sure your oral health is in good shape before you undergo surgery, because infections in your mouth can complicate your recovery and even lead to serious complications. I've had patients whose surgeries were delayed because we found active infections in their mouths that needed to be treated first. Let me share another story with you because I think it illustrates why all of this matters so much. I had a patient named Elizabeth. She was 81 years old, still sharp as a tack, lived independently, very proud woman. She came to me because she was having trouble eating. She had a few teeth left, but they were loose and painful. She'd been putting off dental work for years because she was afraid of the pain, afraid of the cost, afraid of being judged. When I examined her, my heart just sank. She had advanced gum disease, several teeth that couldn't be saved, and she was malnourished because she couldn't chew properly, so she'd been living on soft foods and soups. But here's what struck me most. Elizabeth was isolated. She'd stopped going to social events because she was embarrassed by her teeth. She'd stopped smiling. She'd stopped engaging with life. We developed a treatment plan together. It took time. It took patience. We extracted the teeth that couldn't be saved. We treated her gum disease, and eventually we fitted her with dentures that actually worked for her. And the transformation wasn't just physical. Elizabeth started smiling again. She started going to her church socials. She told me she felt like she'd gotten her life back. And that's when I realized something. This isn't just about teeth. It's about dignity. It's about quality of life. It's about being able to eat a meal with your grandchildren, laugh at a joke, and show the world who you really are. So if you're someone who's been putting off dental care because you're afraid or embarrassed, I want you to hear this. You are not alone. So many people feel the way you do, but you deserve better. You deserve to be comfortable. You deserve to enjoy your food. You deserve to smile without shame. And there are dentists who understand, who care, and who will work with you to find solutions that fit your needs and your budget. Now, I want to talk about one more thing before we wrap up, and that's the emotional side of all of this. Losing teeth, dealing with dental problems. It's not just a physical issue, it's emotional. I've seen patients become depressed. I've seen them withdraw from social activities. I've seen their self-esteem crumble. And in our society, we don't talk about this enough. Your smile is part of your identity. It's how you express joy, warmth, and connection. When you're self-conscious about your teeth, it affects everything. Your relationships, your confidence, your willingness to try new things, and especially for seniors who may already be dealing with other losses. Losing teeth or dealing with oral health problems can feel like just one more thing that's being taken away. But here's what I want you to understand. You have more control than you think. Yes, aging affects your oral health. Yes, medications and medical conditions create challenges, but you are not powerless. Every single day, you make choices that either protect your teeth or put them at risk. Every time you brush, you're fighting back against decay and disease. Every time you floss, you're preventing infection. Every time you see your dentist, you're catching problems early. And even if you've already lost teeth, even if you're dealing with dentures or implants, you can still have a healthy mouth. You can still enjoy your meals. You can still smile with confidence. It's never too late to take control of your oral health. So let's recap what we've talked about today, because I know it's a lot of information. The 3 hidden dangers in your mouth after 60 are: first, dry mouth, which destroys your natural defenses and leaves your teeth vulnerable to rapid decay. Second, root exposure and root decay, which happens as your gums recede and exposes the soft, vulnerable parts of your teeth. And third, chronic gum disease, which doesn't just affect your mouth, but spreads inflammation throughout your entire body, affecting your heart, your brain, and your overall health. But the good news is that all 3 of these dangers are preventable and manageable if you know what to look for and take action. Stay hydrated, manage your dry mouth, keep your exposed roots clean and protected with fluoride, maintain excellent daily oral hygiene, see your dentist regularly, be honest about your medications and health conditions, and pay attention to the warning signs: bleeding gums, sensitivity, loose teeth, persistent bad breath. These are not just normal parts of aging. They're signals that your body needs help. I want to leave you with this thought. Your mouth is the gateway to your body. Everything you eat, drink, and breathe passes through your mouth. It's where nutrition begins. It's where infection can start. It's where systemic disease often shows its first signs. Taking care of your oral health is not vanity. It's not optional. It's one of the most important things you can do to protect your overall health and maintain your quality of life. And if you've gotten this far in this video, I'm grateful. I'm grateful that you care enough about your health to spend this time learning. If you found this helpful, I'd love it if you'd subscribe to the channel, because I'll be sharing more information specifically for seniors who want to stay healthy, active, and thriving as they age. And if you have questions, leave them in the comments. I read every single one, and I do my best to respond. I also want to encourage you to share this video with someone you care about. your spouse, your sibling, your friend, because chances are they're dealing with some of these same issues and don't even know it. The more we talk about these things openly, the more we can help each other. Remember, getting older doesn't mean giving up on your health. It means being smarter, more intentional, and more proactive. Your teeth have served you well for decades. They've helped you nourish your body, express yourself, and connect with the people you love. They deserve your attention and care, and so do you. Thank you for watching. Take care of yourself, and I'll see you in the next video. The core health principle. Your mouth is not separate from your body. It is the gateway to your overall health. The same habits that protect your teeth also protect your heart, your brain, and your longevity. By caring for your oral health with intention and awareness, you are not just saving your smile, you are investing in years of vitality, dignity, and joy.